My name is Destiny Conover, and this is my community service project presentation. I worked with Anna and Crystal to create a resource and education booklet for at risk and homeless women and mothers in our community called Your Guide to a Healthy Pregnancy and Womanhood. We created an organized booklet that's going to be given to all at risk or homeless women processing through the intake at our local mission. This booklet provides educational materials for women's health and services, pregnancy, postpartum, newborn care, and local, free, and accessible resources available to meet their needs. We focus this project on the well being of the mother baby dyad, meaning that it does have education and resources that are all pro life. This booklet was designed for the women who process through the intake at the mission. They're often homeless and considered at risk, meaning them and their children are at a heightened risk for adverse outcomes. We wanted to provide them with essential education and resources in our community, and we had to pay special attention when writing this book to write it in a way that women of all educational backgrounds and reading levels can understand it. We designed this book to be used for a really long time. The document is edited easily to accommodate for changes in the educational material or the resource portion of the book. The booklet was given to the Good News Rescue Mission as well as North State Care Clinic, specifically people that work in the resource department and intake department. We created this book and worked closely with the staff at the mission because we wanted to meet a need that was missing in our community, and we wanted to contribute to the well-being of the mothers and babies here in our town. The purpose of this project is to provide these at-risk women with easily understandable educational materials for all stages of their women's health, life, and pregnancy and postpartum and newborn care. I referenced several studies when working on this project, but I wanted to highlight a couple important things here. First, the number of unsheltered homeless women grew by over 25% in 4 years. This proves that there's a need for women to have access to resources that connect them to help find housing and shelter. There was another study that concluded that homelessness among pregnant women is associated with adverse perinatal outcomes that include adverse neonatal outcomes. This proves that there's a need for assisting women to obtain accessible and equitable prenatal care, and that there's a need to support them and help them find adequate care so that we can lower the risk of these adverse outcomes. I also wanted to discuss how ACOG talks about the high risk of illness and injury for homeless women and the lack of care that they obtain due to their circumstances, meaning unsheltered or homeless. ACOG addresses the need for accessible community resources and care for these women and their need for education and resources available in the community. This addresses the need to bridge the gap between women that require care and the free or accessible resources that are available to them in their community. Our booklet is going to serve as that tool to empower women to access care because it is important for them and their unborn children to improve their outcomes. First, we had to create a team. We knew this was going to be a large-scale project, and so the three of us worked together to create an outline for our book that met all the needs of the women and babies in our community. And then we assigned each team member sections of this book to research, write, and format. We then had to make connections within our community, mainly connections with Good News Rescue Mission, but we also included North State Care Clinic. We also used a local midwife who has connections with the mission, and we split up the responsibility of keeping in contact with these people from scheduling meetings and obtaining information from them as needed. And then we had to complete the book, so we had to take all of our separate sections of the book, combine the information, and format it in a cohesive manner. And then we had to distribute our book to the community. So we planned with the intake coordinator to drop off this book and teach them how to use it, the purpose behind the book. And then we made a plan with them to follow up for if we can hear how effective this was or if things need to change. We hope that this has long-term impacts on our community. We want to provide essential education to these women and improve their outcomes. We did receive positive feedback about the book, and we'll keep in contact with them about that. And we hope that this book provides education and empowerment to women and improves their outcomes of the mother-baby dyad. This book is the tool to bridge the gap between women and the accessible care for years to come. We did encounter some barriers, including finding free and accessible resources, creating this book in a way that all women can understand it, regardless of reading level or educational background. We had to learn how to format a book. We had to navigate so much staff at the rescue mission. Some of them were volunteers, which made it very tricky. Our book was not as well received, probably because there was a volunteer who was there at our meeting who received the book, and so she wasn't really aware of what was going on. And then we had to find a way to work together as a group and keep the work equal. The costs were lower, there was time, fuel, and mileage put in, but the materials weren't as much as we thought they were. Special thank you to the Good News Rescue Mission and North State Care Clinic for giving us their time and learning about our project and for being well receiving of our project. Thank you to Nora McNeil, a local midwife who had the connections with the rescue mission that she provided for us. And then thank you to my group for communicating so well and sharing the load of this project. Here are my references that I used.